Welcome everybody to the Neuromuscular Fellowship Fair. We're excited that you joined us tonight. We have 4 programs presenting for you tonight. So we have Icahn School of Medicine at Mount Sinai, Montefiore Medical Center, we have Weill Cornell Medical Center, New York Presbyterian Hospital, and we have NYU Grossman School of Medicine. Each of the programs will give a brief presentation. They can share information about their programs and about their fellowships. And then after we conclude that, we will go into a question and answer session. We will be utilizing the chat for that. If you have questions throughout a presentation, feel free to go in and put the question in the chat. We just will not be answering any of the questions until at the very end. All right, so let's go ahead and get started.
Hi, I'm Susan Shin. I'm the neuromuscular PD at Mount Sinai Hospital. We have an ACGME accredited program, 1 year. We accept 2 neuromuscular medicine fellows and 1 clinical neurophysiology fellow in the EMG track. We request that applicants graduate from an ACGME accredited neurology residency, but I know that there was also an interest in a applicant from a PMNR residency, and everyone is encouraged to apply. We'll, I think it's completely fine to take from both neurology as well as PMNR. Mount Sinai does accept various visas. So we see a lot of really interesting neuromuscular conditions at Mount Sinai, as well as Einstein and NYU, but I'm trying to win you to Mount Sinai. We have a dedicated ALS clinic. We have a neurogenetics clinic where we see metabolic myopathies, channelopathies, familial amyloid polyneuropathies, just a lot of very interesting cases. We definitely also have, bread and butter cases as well, but most of our referrals are actually pretty complex, CIDP, complex brachial plexus disorders, facial nerve injury, and things like that. So we have a large volume of nerve conduction studies, EMG, about 1,600 studies per year. We do motor unit analysis, single fiber EMG, rep stim, testing facial and trigeminal nerves, brachial plexus, as well as inching studies. Other procedures that the fellows learn include skin biopsy, diagnostic neuromuscular ultrasound, using ultrasound to guide your botulinum toxin injection for limb spasticity, focal dystonia, hemifacial spasm, as well as interpretation of muscle and nerve pathology and autonomic function testing. Our lab is pretty much fully functional now, fully operational 5 days a week, and our volume is actually close to pre-COVID levels. So there's a strong didactic component to the fellowship. We have neuromuscular pathology teaching conferences, biweekly neurophysiology lectures, monthly neuromuscular case conferences, monthly journal clubs. The fellows are expected to teach the residents and medical students that rotate through the electrodiagnostic lab. And we encourage our fellows to participate in many of the research projects going on in the center. So I couldn't list all of our little case reports and papers that the fellows have published, including Dr. Alina Zakin, but we see a lot of interesting things and encourage our fellows to write them up. So in addition to our neuromuscular medicine faculty, we have on site wonderful neuropathologists, Dr. Susan Morgello, Dr. Claire Bryce, also a neuropalliative care specialist who also does the ALS clinic, Dr. Carolyn Crooms, neurogenetics, Dr. Joanna Jen, and Fatmir was our on the front page of the ABEM website when he attended the conference, and he's our amazing technologist who taught me how to perform nerve conduction studies, and the fellows love him. And Dr. Herskovitz should recognize this gentleman here, Dr. Ed Bahu, who is also a star neuromuscular fellow at Sinai. We have several EMG machines, actually purchased 4 new ones in the past year. We have a TerraSound ultrasound machine and just recently received our new GE ultrasound machine and an on-site autonomic lab. The fellows get to hang out in a dedicated fellows room, and they have their own personal computer where you actually have the EMG software on site, so you can finish your EMG reports at your desk instead of doing it somewhere else. Okay. So we're this Mount Sinai health system throughout Manhattan, but majority of the time you're spending at the Upper East Side campus, the Mount Sinai Hospital. The ALS clinic does meet every Monday at Mount Sinai Beth Israel, and the fellows take turns attending it. So one fellow will go every single Monday, then the next Monday the other fellow will go each Monday. At Mount Sinai West, we have several excellent neuromuscular faculty, and you work with their schedules and typically go there about 2 to 3 times per month. But you're not required to travel between the campus in any given day. There is a shuttle bus throughout the health system, but you're not going from one campus to the next. Our fellowship, there is no night or weekend calls. It's Monday through Friday, just 9 to 5 p.m. Fellow benefits, competitive stipend, excellent health benefits. If you do present at a professional meeting, there is travel funds for both publishing and attending the meetings. There's many opportunities to moonlight throughout the health system as well. So many of our graduates usually get the job of their choice. Majority of them end up actually staying in academics, and they're very successful. You will actually hear from Dr. Alina Zakin, one of our rock star prior fellows, who's now competing with me for applicants over at NYU. She's probably going to build an amazing program there. And so we're very proud of all our graduates. So that is it, pretty brief, and I'm happy to answer any, questions during the Q&A session, and also hoping to meet all of you guys on the interview trail. Thank you.
For those of you not familiar with Montefiore Einstein, Monty is a massive health system in the Bronx, Westchester, and Rockland counties. It serves a very large catchment area and an underserved population. And the Moses Division, which is what you're seeing here in the Northwest Bronx, is the mothership. All of the specialties, neurologic and otherwise, are well represented here. And all that means that we basically see anything and everything here at Montefiore. Lots of clinical material to work with. So the neuromuscular division has 8 dedicated faculty who are involved in the education and supervision of the fellows, plus our neuropathologist. We take 2 fellows a year. I counted number of fellows we've graduated over the last 35 years that we've been doing this. We've been doing this a long time, and that's over 70. And in fact, I was the first fellow back in 1986, 87. So I assume some of you won't get to physically see this place, so I just thought I'd visually show you, for what it's worth, socially distant waiting area, a conference room, a fellows room, our EMG consultation rooms, our ultrasound room. So we have an extensive educational program. We like to begin the year with didactics in EMG and neuromuscular ultrasound and clinical subjects, and that morphs into a journal club for much of the year. And in the latter part of the year, we also do board prep, and of course you take an in-service exam, and that prepares you for your ability to take the boards in both the ABEM and ABPN neuromuscular. We have weekly neuromuscular rounds, and that singularly is the most important, I think, forum for learning. There's nothing that's better for a fellow to learn than to try to teach someone else something you've just read about. Neuropathology is mostly case-based. We review the cases with our neuropathologist, and the fellows will present it at the slides and neuromuscular rounds and learn how to think about that. We have weekly grand rounds. We also have an additional case conference that's both adult and peds and may include neuromuscular. We have academic half days that perhaps delve into more the art of medicine than the science. And of course, resident teaching is important, and you get that opportunity with rotating residents and fellows, residents and medical students in the lab and of course in the clinics. This gives you an idea of what the day is like. We figured out long ago that nobody likes to come in on a Monday morning, so there's no conference. But otherwise, we start with a conference every day at 8 a.m., EMG or journal club, neuromuscular rounds, grand rounds, clinical case conference. And then the mornings and afternoons are a mixture of EMG and neuromuscular consultations, both inpatient and outpatient. We do over 2,000 EMG studies a year in the system. Myasthenia clinic and MDA clinic weekly. We expose you to all the electrodiagnostic studies. We don't use technicians in our labs. All of your training is done by attendings. I trained all of them in EMG. And so we're with you, right by your side for the first few months. It takes a few months to learn nerve conductions. It takes a lot longer to learn needle EMG, and we're with you through that, giving you progressively more autonomy as the year goes on. And you'll get facile with all these things. Neuromuscular ultrasound, as you've heard and will hear, it's become an integral part of a neuromuscular practice, I think, and we've been doing it for the last 8 years or so, and it's proven to be exceptionally helpful. 2 of our attendings are involved in EMG-guided chemodenervation. We do our own skin biopsies and neuropathology with our neuropathologist. Most of our fellows live in Manhattan and commute. It's a fairly easy commute up to the Bronx. Otherwise, they live most anywhere else in the tri-state area, but many in Montefiore housing, either right next door or in Riverdale. That's all available. This gives you a little idea of what the benefits are. The mundane things like salaries and stipends and other benefits. Where do our fellows go after they graduate? I tabulated the last 5 years. There were 11 fellows graduated. 4 went into private practice, 7 into academic practice around the country, mostly in this area. And of course, we want you to be involved in existing and new creative publications. Here's a listing, partial listing of the last few years of our fellow publications, including muscle and nerve and neurology. So even though it's a year program, they tend to be quite productive, which is very nice. And with that, I will move on. Thank you.
Hi, I'm Dr. Dora Lang, and I'm going to present the program at Hospital for Special Surgery, Weill Cornell Medical Center. Okay, let me make sure. Okay. We're located on Upper East Side of Manhattan, right next to the East River and over the FDR Drive. And our campus is right next door to the Cornell New York Presbyterian Hospital. HSS is ranked #1 in orthopedics and #4 in rheumatology. We see over 500,000 of outpatient visits a year, and we perform over 35,000 surgeries. The Neurology Department in 2019 saw over 6,700 outpatient encounters and over 2,100 EMGs, so we're busy. The Department of Neurology is located in a building across the street from the hospital, very convenient, and there's a skywalk. Just to give you a little tour, this is our reception area and waiting room, a sample EMG room and patient exam rooms. We have a total of 10 on the floor. Our EMR is Epic, and we use the latest EMG machine. There's a conference room in which we use grand rounds conference team meetings. And before COVID, we also use it for departmental happy hours. And hopefully in the near future, we can go back to that. We had to expand a couple of years ago because we need a much larger infusion suite. And we're also on the 11th floor now. And currently the infusion suite can accommodate up to 10 patients at a time. And this is a view of an infusion suite. And just so you know, this is our fellows' offices. On the left is current fellow, Dr. Nick Stryker, and on the right is Dr. Elizabeth Eng. You can see there's plenty of space and a view. There are 7 neurologists in the department, and 6 of us are neuromuscular specialists. Dr. Dale Lang is the department chair, as well as the neurologist in chief. I'm the program director, and you can see our board certifications. Dr. Shetty also runs the concussion clinic for our department. Dr. Pavlakis is a former fellow who has an interest in small fiber neuropathy. Dr. Manning is also a former fellow, and she has interest in sports neurology as well. And we also have Dr. Reichler and Dr. Stobans, who's a movement specialist who does Botox. It's a 1-year ACGME accredited program. It's sponsored by HSS as well as Cornell. So our graduates actually have 2 diplomas. We have 2 fellow slots a year. In addition to seeing neuromuscular patients, be proficient in EMG and clinical research, our fellows also rotate to Cornell and to MSK Cancer Center. The weekly didactic sessions, including starting with basics of nerve conduction and EMG, and then we segue to topics in neuromuscular medicine over the year. There's weekly neurology grand rounds at Cornell, which covers general neurology topics, and the HSS grand rounds tend to focus more on neuromuscular issues. We have weekly EMG review sessions and also presentations on relevant topics at the MDA and also clinics. We have monthly radiology conference at HSS, as well as quarterly conference with Cornell radiologists, because we have a research interest in MRI and QSM as a biomarker in our neuromuscular patients. There's also Journal Club and AANEM, and the hospital also sponsors multiple conferences on topics that trainees are interested in. The weekly schedule includes 4 half-days of EMG with assigned attendings on rotating basis, 2 to 3 half-days of seeing neuromuscular patients, 1 half-day each of MDA and ALS Association clinic, and the fellows have half a day of research. And they spent half a day during hospital neurology clinic, alternating with co-fellow. We have 5 dedicated EMG rooms with options for 6. We have 2 full-time nerve conduction technicians, so our fellows really can focus, do the most interesting studies and can focus and spend their time on them. Because they're rotating with 6 attendings, there's opportunity for a lot of studies and doing unusual techniques such as rep-stim, proximal studies, and single fiber EMG. And despite the COVID restrictions, our graduating fellow last year did over 250 studies. Our patient referral basis, including neuromuscular consults from outside the hospital, but within the hospital itself, referral base from orthopedic and rheumatology services. So we see a lot of radiculopathy, focal neuropathy, as well as neurologic complications of rheumatologic disorders. Our clinic is also staffed with a nurse practitioner and a physician's assistant. We are the neurology service for the hospital, so we do inpatient consults. And we also do inpatient neuromuscular consults at Cornell. Keep in mind that we don't have an emergency room, so the patients that we see usually have post-surgical complications with foot drop, weakness, pain, and numbness. We don't have overnight call or weekend call, but there are moonlighting opportunities if the fellow chooses to do weekend call. We are one of the few centers with both the MDA and the ALS Association clinics run by Dr. Lang. The team consists of OT, PT, speech, respiratory therapists, and others. And we care about patient continuity, and so the fellows tend to see the same patients over the year and see what the clinical progression is. We start using telemedicine in this population even before COVID, and we really expanded this past year. And the fellows get to spend at least 1 day a week with Dr. Lang seeing neuromuscular patients, often as a second or third opinion for the neuromuscular conditions. And at other times, they come to see us because they want to be enrolled in our clinical trials. Currently, we have over 30 clinical trials in phase 2 and phase 3 in conditions with ALS, myasthenia, inflammatory myopathy, and CIDP. And this is just some of our sample clinical trials. The fellows rotate to Cornell and they spent a month in the MICU. And all they do is attending morning rounds. There are no patient responsibility, no note writing, orders, or any SCUT. The role there is really to observe and see how they manage pulmonary and cardiovascular issues in critically ill patients. And they also rotate through rehab with Dr. Odell, who is an expert in treatment of spasticity in post-stroke and CP patients. He does a lot of Botox, and he also manages back of the pump. And our fellows find that the rotation is really positive experience. And here he is with our fellow Nick pulling up some Botox for injection. So a few of the extras which set us apart from other programs include the fact that we have a TMS machine and a dedicated researcher when we use it for diagnostic and treatment purposes. We have clinical research going on, including doing triple stimulation tests in ALS to quantify the upper motor neuron function over time. We also studying the stimulation of frontal cortex in ALS patients to see how it affects their mood. There's also a pilot study going on using it for treatment of spasticity in ALS and PLS patients. We have a very strong radiology department and a state-of-the-art neuroimaging technology. We have experts in MR neurography as well as nerve ultrasound, and that really helps us in diagnosing peripheral nerve disorders. And the picture on the left is Dr. Daryl Sleet, and he is an expert in using MR neurography, and he's written a lot of papers on Parsonage-Turner syndrome. We also have a very strong brachial plexus surgical team, and the fellows have exposure to the monthly conferences in which they discuss complex nerve repair and transfer procedures on the patients who have poor recovery from their injuries. The fellows also rotate at MSK Cancer Center, and they spend time with 2 attendings to see our patients for consult and EMG. And the patients there tend to be have neuromuscular complications either directly or indirectly due to the cancer or treatment. The rotation is 1.5 to 2 days a week for 4 to 6 weeks, and MSK is only 3 blocks away from HSS, so very convenient. Now, the concern for applicants may be where would they live, because housing is expensive in New York City. We have guaranteed housing for fellows, and the housing is a very short walk away from the hospital. They are staffed by 24-hour doormen. Pets are allowed, and there's laundry facility as well as a gym. The housing size depends on the family composition of the fellow. And this is the indoor courtyard of the previous building. And this is a sample 1-bedroom housing apartment. I was told it's 900 square feet, and they have plenty of closet space. The rent is about $1,800 to $2,500 a month. And just for reference, our PGY5 salary is just under $96,000. And picture of the kitchen, and the picture of another apartment and the gym. And last but not least, I want to talk about meetings and conferences for fellows. We fund our fellows to go to the annual news meeting every October in Florida, and we'll also reimburse for another annual meeting. However, for any fellows who's presenting an HSS research at any meeting, we will sponsor and reimburse for those too. And in fact, one of our prior fellows went to Ireland to present at the MND conference. And we encouraged our fellows to submit to AN and AANEM meetings. And this is a picture of our prior fellow, Dr. McSulu, who was accepting the President's Research Initiative Award at the AANEM meeting in 2019 in Austin. And this is Dr. Pavlakis doing his platform presentation at 2017 AAN meeting in Boston. And NEO's conference was virtual this year, so we did it in our conference room, but we always have a dinner afterwards. And this is outdoor dining in New York. And what do our fellows do after they graduate? Well, Dr. Manning and Dr. Pavlakis stayed on as faculty. And other of our fellows have graduated and went to academic settings, including a former fellow who started ALS Center at the Hackensack Meridian System in New Jersey. And many others also went to hospital-based practices. And this is a picture of our fellows who graduated last year, and we had a cupcake party as a send-off. And I think this is the end of my presentation. And my contact information. My fellows are not available today, but they are free for any interested applicants to get in touch with and for questioning. And that's it. Thank you.
I'm Dr. Icahn. I'm the Neuromuscular Program Director at NYU, Grossman School of Medicine. Thank you everyone for joining, and I'll tell you a few words about our institution, just some recognitions and honors. Number 5 Best Medical School for Research and 10 for nationally ranked in top 10 for 15 adult specialties, multiple accolades and awards, recognized as a magnet designation for nursing excellence, gold seal of approval by Joint Commission, grade A leapfrog hospital safety grades. Our footprint is expanding. So, we have now grounds in in Brooklyn and Long Island, and then multiple satellite clinics. As a fellow, you will be predominantly based in Manhattan, although we're trying to see if there's ways, if individuals are interested, to have opportunities at other sites, depending on interest. Extremely busy, across the institution, over 7 million outpatient visits, including 6 inpatient locations, 4 emergency rooms, and the like. Our staff includes 4,100 physicians and faculty. This is for the whole institution, and multiple trainees, students, and would include fellows now in neuromuscular medicine. This is probably the newest building that has come onto the scene. Our beautiful Kimmel Pavilion, equipped with single rooms and wonderful views, and our amazing neuromuscular team. So I have been appointed the neuromuscular program director very recently, and I'm very excited to take this on. It's a brand new program for us. And our division director is Dr. Kaprovsky. We have 16 amazing attending physicians who specialize in neuromuscular medicine and EMG. And we are sort of combining our division to be situated at 38th Street, which is where our EMG machines are. And hopefully we'll all be seeing patients in the same building. And we're a little delayed because of COVID to get this up and running, but it's going to be happening by this coming winter, 2021. So what is life like as a neuromuscular fellow? We typically split you between EMG time and neuromuscular clinical time, and can happen kind of in the same day. Typically 8:45 a.m. you're in the EMG lab and the day ends by 5. You are working closely the first few weeks with a wonderful technologist. Her name is Rosie, honing in your skills. And then on days where the technologist is unavailable, there is an attending physician that you're going to be rotating with that is going to also be assisting you and teaching you in doing the nerve conduction studies. All needle EMGs are done with supervision by an attending physician, and gradually you get independence throughout the course of the year. Clinical time is seeing patients with us in the clinic, goal being that you are seeing new patient consultations, performing thorough histories, detailed exams, and then really working on your differential diagnosis, diagnostic workup, and coordination of care with other subspecialists. Once a week, you do rotate through the MDA clinic, which has both adult and pediatric neuromuscular specialists. The block schedule as we have it right now, divided between clinical EMG time, clinical neuromuscular time, and EMG lab time, 4 weeks of vacation included, and opportunities to do electives in pediatric neuromuscular disorders, neuromuscular rehab, work with neuropathology, and also have some scholarly activity and research time. We also are going to be having neuromuscular ultrasonography, so that's something that I do pretty actively in the EMG lab, trained by Dr. Susan Shin, as well as chemodenervation. For various indications, we perform skin biopsies, and we work with our plastic surgeons and would have the opportunity for you to rotate with them for nerve and muscle biopsies, both in their outpatient setting as well as in the operating room. You have no call. Your weekends and evenings are your own. We encourage you to use the time productively and perform quality improvement projects or research, and there's opportunities to be involved as we have tons of faculty working on things. There is, for those interested, an opportunity to moonlight, so we can discuss that if that's something that people are interested in. The fellowship curriculum. So every week there's a neuromuscular didactic course really focused on EMG technique and neuromuscular disorders. Every month we are having a neuropathology conference, as well as a monthly journal club. Dr. Tawani, who's one of my colleagues, organizes a monthly neuromuscular clinical and pathology conference that is broadcast to all sites. So that includes NYU Long Island, NYU Brooklyn. Every year we have the annual AANEM in service for both neuromuscular and electrodiagnostic medicine. And prior to the exam, we have a full day dedicated review session. And then there's opportunity to be involved and also present at departmental conferences, including the weekly grand rounds, the pediatric grand rounds, and then a quarterly M&M conference. We also encourage our fellows to both attend and present in national meetings where departmental funding is available. And of course, virtual conferencing is set up. Teaching. So I really am trying to create a fellowship where there's opportunities for the fellow to be involved as faculty. So starting from the most basic, preclinical medical students in basic sciences, opportunities to give lectures there, involvement in the residency education curriculum with noon conferences, as well as working with the residents when they rotate through the EMG lab, anywhere from PGY 2 to 4, and then performing, consultative work inpatient, working with the residents closely who are on the neurology services. We focus on wellness. We want our fellows to be happy, as we want all our residents to be happy. So again, we mentioned you have no call. We observe duty hours. You're probably never going to be staying past 6 p.m. in the office. We encourage you to network and attend conferences. And you, of course, be living in the best city in the world. So you get to enjoy everything New York has to offer. Professionally, we want to focus on your education and academic development. We want to provide formal assessments as the year progresses. And we really take your feedback into account. The goal here, this is a brand new fellowship. We're trying to optimize it so that it best fits the needs of the fellow, and also allow us to create a program where everybody is happy with what they're doing and how they're learning. So focus on quality improvement and quality education, and the opportunity to have the fellowship evolve as you go on. We're looking for an academic powerhouse. We're looking for somebody who's excited, who's interested, who's really a good fit with our department for a one-year ACGME accredited fellowship. So I'm very much excited to welcome you guys to NYU and tell you more about our program. Thank you for your attention.
All right, thank you so much for all of that information. So now we're going to open it up, residents, to you for question and answers. Go ahead and, like I said earlier, use the chat feature. Make sure you indicate who the question is for. To kind of get us started, I am going to ask the first question. So program directors, fellows, anybody on the call, can you answer as far as what drew you to neuromuscular medicine? Why would a resident want to go into neuromuscular as opposed to some other specialty?
It's the most interesting topic in neurology as far as I'm concerned.
We're also so taught in residency and all throughout our training about protocolized medicine, about getting the CT-CTA, and neuromuscular is really the time where you're thinking about the patient, you're examining the patient. Every history, every detail in the exam is going to shape your ultimate assessment. And I think that's very unique throughout our training, that theme that never goes away. It's not a protocolized subspecialty, which was what drew me to neuromuscular medicine.
What drew me originally was a mentor who is still on our faculty, Mike Swerdla, who is probably the best clinician we have, right, Sakina? And I think a lot of how you choose things has to do with who you and what you're exposed to. So he was the example. I think you're making good choices in going into neuromuscular medicine. I think you're going to be among the best clinicians there are, because it's very hard to train residents in neurology in this subspecialty. Inpatient neurology is mostly non-neuromuscular. And for those that don't do fellowships, I don't think they become the great clinicians that they can be. In my experience, the best fellows tend to be those that have also done neuromuscular and go on to practice. So you're making an excellent choice. I mean, it's a wonderful field that is really taking off now, isn't it? Finally, we have ways to treat things. And some of the new technology like neuromuscular ultrasound is very exciting. After doing only EMG for 30 years, it was a breath of fresh air to add something new to the armamentarium.
Yeah, I have to say now, Dr. Herskowitz, remind me, my mentor was Dr. Louis Rowland at Columbia, and also I trained under Dr. Lang. And I have to say, I learned so much from them, and having a good mentor really makes a huge difference in how you learn, how you view patients and approach them. So I felt like I learned from the best.
I think as neurologists, we always hone in on, anatomic localization, the importance of the clinical exam. And, they say that EMG is kind of the extension of the neurology exam. But, Dr. Herskowitz and anyone who does diagnostic neuromuscular ultrasound will now see that you're seeing maybe a slight abnormality on the EMG, and then you bring in your ultrasound machine and you can see the inflammation within the nerve, a huge plexiform tumor that's causing a pseudoconduction block on your nerve conduction study, inherited CMT, where sometimes the nerve conduction studies don't give you the classic CMT1A severely demyelinating phenotype, but then you look at the nerves and every single nerve is uniformly enlarged. And we have Xiao Wang, who is our current neuromuscular fellow. Maybe you can say a few words, Xiao, of all the kind of cool cases you've seen so far.
Thank you, Dr. Shen. My name is Xiao Wang. I'm currently a fellow in neuromuscular medicine at Mount Sinai. Yeah, I'd like to just share my experience with you, the residents on the chat today. Really, when you look for a program to apply to, you want to look for a program that, gives you a variety of experience, in terms of procedures or the, cases that you're seeing. The reason I like Mount Sinai is because, this program teaches you a variety of skill sets that are very attractive for the current job market. Whether you're interested in pursuing academic or private medicine. Here, we do procedures almost every day, 4 to 5 days, a week. We would do EMGs. Occasionally, we would do skin biopsies, nerve ultrasound, and also Botox procedures. And to be very honest with you guys, I think we might have like one of the best EMG technicians in Fatmir. He moved to a program from MGH not long ago, and he's very knowledgeable and can solve almost any problem you guys can run into regarding nerve conduction studies. So when you start off in this program, he'll spend afternoons with you, just going over the basic studies and making sure that you get the basic steps right in terms of doing procedures. And then obviously, you have the support from the awesome attendings that we have at Mount Sinai, who is there with you, for every procedure, in terms of needling that you do. So again, like I said, we do a lot of procedures with, skin biopsies, nerve conduction study, EMG, Botox. Also, Dr. Simpson, he's very renowned guy in Botox procedures. I'm very lucky to be trained after him. And, Dr. Shen was saying, we see a lot of interesting cases, almost on a weekly basis. I was able to be the first person to diagnose someone with such as, motor neuron disease or CIDP, using the procedures I do every day. And, most of the time you get referrals from, just private places, and, they ask you for a second opinion. You see the patient, you do the study and you find out that, this is not what the patient has, and you be the first one to diagnose the patient. And, the patient are usually very grateful for what you do for them. As a fellow here, we're busy, but not overwhelmingly busy. We normally come in at around 8:30, and get everything done by 4:30, you know, including notes and everything you have to wrap up. So really the lifestyle here is good. We don't do any overnight calls or weekends. But yeah, like, you know, I really couldn't be happier, you know, with the training I have here. You know, Dr. Shen, she's been amazing, you know, mentor both inside the hospital and outside the hospital. So yeah, you guys,
Yeah,
you know.
just text me your Venmo number later, okay?
We'll work on that. But anyways, yeah, you know, feel free to contact me with any questions or concerns, you know, you might have, you know, or if you just want to chat with me and getting to know more of the program, you know, I'll be happy to talk to you. So thank you.
Thanks, Zhao.
I think another aspect that draws people to neuromuscular disease is, aside from the clinical aspects of it, is the research aspects. And that was a strong impetus for me as a graduate student after medical school. I was lucky enough to work with Dr. Dalakas, and then I came to HSS and worked under the mentorship of Dr. Lang and Dr. Long, and I was under a great environment there. We were able to write 3-4 grants during my first year of fellowship, and getting a lot of stimulation both from clinical research and collaborating with other basic science from the hospital from the rheumatology division. So it's a good combination of both the clinical specialty and a research specialty. I think maybe 10, 20 years ago, neuromuscular doctors might have been considered more clinicians, old school, and we saw a lot of advancements in areas like movement disorders or multiple sclerosis. But I think with the advent of new therapies like gene therapies, immunotherapies, the next decades will be the decades of neuromuscular medicine. I'm sure we'll see a lot of advancements there. So it's a pretty exciting time to be a neuromuscular specialist.
Everyone, this is Dr. Pantelis Pavlakis, my former fellow and current colleague.
Alina, I think there's a question for NYU in the chat box.
Sure. So out of the 16 attending, so there's a mix of pediatrics as well as adult, a few attendings who staff the MDA clinic, and then there's opportunity to really rotate through EMGs with all the various attendings. So you'd have a mix of all 16, but not everybody, you know, in the same week per se. So we're still working out who's going to work directly with the fellow on a regular basis versus rotating through things like the MDA clinic, continuity clinic, things like that. And we do have Dr. Kirill Kaprovsky and Dr. J.D. Bott, who are both excellent at single fiber EMG, to answer the second question. So there's opportunity to work with them.
At Sinai, I believe it's Dr. Shelsa. Did you train him, Dr. Herskovitz? Because he,
I did train Dr. Shelsa, yes.
So he does our single fiber EMG.
Right. Well, we don't do a lot of single fiber EMG simply because our referral base doesn't request a lot of it. So it's uncommon, but we can do it. My feeling about that technique is it should be left to people who do it a lot, personally.
For our program, there's opportunity to learn single fiber EMG, but again, I think the need and the request for them has been dropping over the years, especially because they're the new antibodies that came out for the myasthenic patients. And so for many people, once they test positive for antibodies, they don't sometimes even send them for routine diagnostic studies. But our fellows have opportunity to learn. Dr. Pavlakis certainly learned during his fellowship year.
Okay, another question that we've had throughout the 4 weeks that we've been doing this, and one of the programs, you did touch on it, but do any of the other programs take applications from PMNR residents?
So there was a candidate who was asking about this, and I inquired from our GME, and the answer is yes, we can accept them. They would have to ask their certifying board to see what they would take after they complete the fellowship. I believe they can sit for the ABEM that comes through AANEM EMG board, but they would not be able to sit for the ABPN Psychiatry, Neurology, Neuromuscular Medicine board exam.
We've never taken a rehab applicant, but I'm not averse to the idea. If I have a good applicant, I'm willing to consider it.
We have not taken a PMNR applicant either. And I feel that because I think that our bent on training is different from the neurology aspect compared to the rehab aspect. So I'm not sure it's necessarily the best fit. And also because I feel like if they cannot take out boards from the ABPN, it may not be too helpful to them.
For us, in terms of what Dr. Shin and Dr. Herskovitz had already mentioned, I think we are encouraging excellent applicants from both adult neurology and PMNR if there is interest. And we have to figure out, I think it's the ABPMR neuromuscular boards. They have their own separate like body that they'd have to be boarded under. But the ABEM electrodiagnostic medicine, they'd be able to take.
Do one last question here. Okay, this is for each of the programs. Can you kind of give us an idea of what makes your program special? Why should they choose you over one of the other programs?
I hate this question. I think we should form one fellowship for all of us. This would make quite a powerhouse of academia.
That's a great idea.
We all have our strengths and weaknesses, but I think these are 4 wonderful programs. I don't think any of you can go wrong with any of them. You'll just have to decide which one is the best fit for you.
I agree.
I think I'm going to have my former fellow, Dr. Pavlakis, answer this one for me.
Well, I think, first of all, as the name implies, we're at Hospital for Special Surgery, so I think that speaks for it. But to answer more seriously, I think HSS is a good combination of very rare things and very common things. You'll see things you won't see anywhere else, but you'll also be very good at things you will need to see anywhere else. It's a great atmosphere. It's a great team of people to work with. That's why I stayed on, and we'll be happy to meet you further in the interview trail.
Wonderful. Thank you, guys. Okay, one last one quick that came in. NYU, how many spots do you have?
Just 1 spot for the coming year.
Okay, perfect. All right, well, we'll go ahead and get this wrapped up. First and foremost, thank you so much, programs. We appreciate your time that you put into doing the presentations and sharing with us your time tonight, because we do know how busy your schedules are. So thank you so very much for doing that. A couple things quickly just to share with you in terms of the AANEM. We do have a couple upcoming events. You may have noticed in some mailings come out now, advertisements, the Spring Virtual Conference. So that is happening March 2nd through the 5th. So registration is open right now. Residents and fellows, just like we had with the AANEM meeting, you are able to attend that for free. So it's a wonderful opportunity. So please come and join us for that. For those of you taking the self-assessment exams, that is happening on May 3rd through the 10th. Please contact your coordinator if you would like to register for those. And then, of course, the AANEM 2021 annual meeting is coming up October 13th through the 16th in Aurora, Colorado. So hopefully this pandemic will be over with and we'll be able to see everybody in person. So again, thank you so much, everybody. Residents, we appreciate your time. We hope you found this fair, very helpful in making some decisions. Please remember to reach out to the programs either through their emails they gave you or through the portal. They'll be happy to answer any of the questions that you have. All right. So thank you again, everybody. Have a great night. Stay safe.